And also those who schedule stuff on school days, you might want to study a little harder.
Can y'all see that?
Yes.
On weekends.
And that's right.
I got all the brush cards yesterday. I'm shut back. I didn't move away for enough. I probably holding you. I did myself on yesterday, but it worked. Right there, put them closer. No more this way.
You, the only one?
And.
Well, that's great. Oh, I see.
If you could provide, mine's not printed either. I've got a picture of it all.
I got it. Well, because they were supposed to send me it, but I don't know if they were
The
actually.
link
You are
from.
here. I know you do that.
So, I was like, I know you have
Because
it.
it was, I got it over at
The
Baxter.
hospital's not even doing.
Did they email you
29 for this.
They were supposed to, they just don't.
We haven't really done the do this.
No, I'm just
Like,
saying.
I think I might.
So go to your email and
You
type
don't know how to keep it out.
I don't know.
I think you're good. So instead of you seeing the screen, I'm gonna see the screen, I'm seeing the screen. They see.
Yeah, that would be the, right, like AHA.
So what you're seeing,
Yeah, for American Heart Association.
they see.
Yeah,
What,
AHA.
Gainesville is seeing. It's just
Yeah,
this.
no, because this is what it should look like. You get an email to it, you can put it in your card, and then also a lot of times they'll send you a text too. I don't know why I don't have it.
Okay, so you're recording. Okay, so I think you're good.
I think my teacher might be supposed to.
I would get it between now and Thursday.
All right, is Tatiana out of the high school students that it's the only one that don't have a book? Yeah.
That. It's going to hurt. That's maybe it.
Heart disease is the #1 cause of death in both men and women globally and claims more lives than all forms of cancer combined. Cardiac arrest may be caused by almost any known heart condition and is often fatal if appropriate steps aren't taken immediately. Cardiac arrest does not discriminate. It can affect all ages, genders, nationalities, and races. This is why early recognition and immediate cardiopulmonary resuscitation, CPR, are crucial for survival from cardiac arrest. Healthcare providers are the backbone of the systems of care in both the community and medical facilities. Advanced rescue measures cannot be successful on their own without solid basic life support, or BLS. This training will guide you through the key practices of high-quality BLS.
Products are shown for demonstration purposes only. The AHA does not endorse or recommend any specific manufacturer or product. In order to show skills clearly, the healthcare providers in this video do not always use recommended personal protective equipment, such as gloves. The AHA's mission of saving lives is a global initiative. The AHA recognizes that heart disease is the #1 killer of both women and men. However, most skills in this video will be demonstrated on male victims to respect global awareness and cultural sensitivity. On any given day and at any time, you can encounter a victim of cardiac arrest because about every 90 seconds, a person dies of sudden cardiac arrest. But with the training you receive today, your actions can give a victim the best chance of survival.
Sudden cardiac arrest occurs without warning or within just a few minutes after symptoms appear. The term heart attack is often mistakenly used to describe cardiac arrest. Although a heart attack may cause cardiac arrest and sudden death, they are different conditions. But it's important to call emergency services for both. There's more information on the differences between heart attack and cardiac arrest in your provider manual.
First, let's talk about the two adult chains of survival. One is for out-of-hospital cardiac arrest, and one is for in-hospital cardiac arrest. The two chains have 6 links, but the links differ slightly. Both chains include activation of the emergency response system, high-quality CPR, early defibrillation, post-cardiac arrest care, which may be provided in the cath lab or the intensive care unit, and recovery.
For the out-of-hospital chain, the difference is the 4th link, which focuses on advanced resuscitation. In this link, a multi-rescuer team arrives and takes over CPR and may perform additional advanced interventions. For the in-hospital chain, the difference is the 1st link. It focuses on early recognition and prevention of cardiac arrest with patient monitoring and assessment, and, if necessary, rapid response by the medical emergency team when a patient's condition starts to deteriorate.
Now, let's review the links in the out-of-hospital chain of survival as they could happen in a real-life resuscitation event. It's a normal day at the airport. A woman notices that her husband is not looking well. When he collapses, she immediately calls for help, and a security guard rushes over. The guard gets no response and sees no sign of breathing, so he directs a coworker to activate the emergency response system. The out-of-hospital chain of survival begins right here, with the guard's immediate recognition of possible cardiac arrest and activation of the emergency response system. A rescuer must recognize that someone is in cardiac arrest. This person will have signs such as unresponsiveness and lack of normal breathing. After recognition, the rescuer should ensure that the emergency response system has been activated and begin high-quality CPR. Effective bystander CPR provided immediately after cardiac arrest can double or even triple someone's chance of survival. Bystanders who aren't trained in CPR are encouraged to provide compression-only CPR, also called hands-only CPR. When an untrained bystander sees an adult collapse suddenly, there are 2 simple steps to follow. Call 911 and push hard and fast in the center of the chest. Dispatchers or telecommunicators may provide further instructions, including step-by-step coaching on how to perform CPR until trained help arrives.
Some rescuers might find it necessary to provide compression-only CPR until a barrier device is available. The guard begins chest compressions without delay. A second guard returns with an AED. This introduces the next link in the chain of survival. The AED, or Automated External Defibrillator, is a lightweight portable device that can identify an abnormal heart rhythm that needs a shock. The AED can then deliver a shock that can convert a rhythm back to normal.
Most sudden cardiac arrests are triggered by abnormal heart rhythms called arrhythmias. A common and treatable arrhythmia causing cardiac arrest is ventricular fibrillation, or VF. With VF, the heart's electrical impulses suddenly become chaotic and ineffective. Blood flow to the brain and other vital organs stops abruptly, and the person loses consciousness. Death usually follows unless a normal heart rhythm and pulse are restored within minutes. The AED uses voice prompts, lights, and on-screen messages to tell the rescuer the steps to take. AEDs are simple to operate, allowing lay rescuers and healthcare providers to attempt defibrillation safely.
As the emergency medical services, or EMS providers, arrive and take over care, they provide advanced life support, extending the chain to give the person the best chance of survival. Advanced life support can occur in any setting and provides more advanced treatment.
Once the return of spontaneous circulation, or ROSC, is achieved, EMS transports the person for post-cardiac arrest care. Post-cardiac arrest care after ROSC focuses on preventing the return of cardiac arrest and improving long-term survival. Recovery from cardiac arrest continues long after hospital discharge and includes physical, emotional, and family support. These 6 links show the most important actions needed to treat cardiac arrest.
BLS is the foundation for saving lives after a cardiac arrest. In this course, you'll learn the skills of high-quality CPR for people of all ages and practice delivery of these skills, both as a single rescuer and as a member of a multi-rescuer team. Now, let's go back and review a rescue, focusing on the steps of BLS as they happen.
There are several steps of BLS that you'll need to perform when you suspect that a person is in cardiac arrest. First, scan the scene to assess safety. Then, check to see if the person is responsive by tapping and shouting. If they do not respond, activate the emergency response system and get an AED, or send someone to activate the emergency response system. Next, check for breathing by watching the chest for rise and fall.
Abnormal breaths are common in the first minutes of a cardiac arrest. These abnormal breaths are called agonal gasps and should not be confused with normal breathing. Rescuers can sometimes mistake agonal breathing for normal breathing and fail to recognize cardiac arrest and initiate CPR. Seizure-like activity can also sometimes delay the recognition of cardiac arrest.
If the person has no signs of responsiveness, the emergency response system has been activated with an AED on the way, and there are no signs of breathing or a pulse, then immediately begin CPR starting with chest compressions. The delivery of rapid, strong compressions is a priority, but be sure to deliver ventilation as soon as the pocket mask or bag mask device arrives. Once the AED arrives, it is important to use it immediately. We will go over proper AED use later in the course.
You never know what situation you'll face or what resources will be accessible. It's important to have the knowledge and a framework to provide high-quality, life-saving CPR, regardless of the conditions and circumstances.
Now, we will focus on the individual skills that rescuers perform. It is most effective to perform CPR as a team, but to be an effective team member, you'll need the individual skills of CPR. So we'll start there.
As a healthcare provider, your first step is to assess the surroundings for safety. Then, tap and shout to see if the person responds. If not, you should shout for nearby help or activate the emergency response system in your workplace. Check for breathing by scanning the person's chest, looking for chest rise. Check for a carotid pulse. The technique of feeling for the carotid pulse is usually easier to perform on the side closest to you. Use 2 or 3 fingers to locate the person's trachea, and then slide your fingers into the groove just to one side of the trachea.
You can scan for breathing and check for a pulse simultaneously to minimize time before compressions. The check for breathing and pulse should take at least 5, but no more than 10 seconds. If you observed no breathing,
That's a
abnormal
best
breathing,
question.
or only gasping, and you do not feel a pulse, ensure that help is on the way and start chest compressions immediately.
Before you start chest compressions, make sure the person is lying face up on a firm, flat surface. If you need to remove clothing to expose the person's chest, do it quickly. You need to work with a bare chest because later you'll attach the AED pads to bare skin.
By starting compressions, you are initiating the CAB sequence, or compressions, airway, and breathing sequence. In the first few minutes of a cardiac arrest, there's still oxygen in the bloodstream. Starting CPR with chest compressions can pump that oxygenated blood to the brain and heart. After you give compressions, open the person's airway and deliver breaths. It's important to minimize interruptions in chest compressions to 10 seconds or less. Each time you stop compressions, the blood flow to the heart and brain decreases significantly. When you resume compressions, it takes several compressions to increase blood flow to the heart and brain back to the same levels. So any interruption in chest compressions can result in low blood flow and minimize the chance of ROSC.
To begin, place the heel of one hand on the center of your mannequin's bare chest, over the lower half of the breastbone. Place the heel of your other hand on top of the first. Make sure that your shoulders are directly over your hands with your elbows straight. And when we start, remember to push straight down on the breastbone to get adequate depth. When you push, push hard and fast. There is some evidence that compressing too deep can increase injuries from CPR. However, a larger problem is that most providers don't compress deep enough. So focus on making sure your compressions are deep enough. Compress at a rate between 100 to 120 per minute while counting out loud, making sure the compressions are at least 2 inches or at least 5 centimeters deep, and allowing the chest to recoil after each compression. We recommend using a feedback device that provides real-time corrective feedback on CPR quality regarding rate, depth, and chest recoil, not just when performing CPR in practice, but also in your workplace. We'll talk more about feedback devices throughout the course, and you will complete some practice and testing with them later.
You can follow along with what's on the screen as you perform compressions yourself. You'll perform 3 sets of 30 compressions after you assess the scene. We'll pause here while everyone gets into position.
Okay, let's begin. In 3, 2, 1.
Hey, are you okay? Are you okay? Help, someone help. Activate the emergency response and get an AED. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
'So now, let's go through the use of pocket masks, and then we'll practice one rescuer skills with compressions and breaths. When you're working, you'll likely have access to a bag mask device. However, because a cardiac arrest can happen anywhere at any time, it's important to be comfortable and effective with a pocket mask. A bag mask device might not be too far away, but when minutes and seconds matter, the time saved by being proficient with a pocket mask is invaluable. We'll use a pocket mask for the one rescuer activity in our training today.
When the guard finishes a cycle of compressions, he quickly places the mask with the one-way valve on the person's face. He delivers 2 breaths and returns to giving compressions immediately to minimize interruptions in chest compressions to less than 10 seconds.
Now let's examine the technique. Place the mask on the person's face, using the bridge of the nose as a guide for correct positioning. Seal the mask against the face by placing the index finger and thumb of your hand that's closest to the top of the person's head along the edge of the mask. Now, place the thumb of your other hand along the lower edge of the mask. Then, place the fingers of that hand under the bony part of the lower jaw near the chin, taking care to avoid the soft tissue under the chin. After that, open the airway by using a head tilt chin lift. By lifting the jaw to bring the chin forward, you'll lift the person's tongue away from the back of the throat, relieving a possible airway obstruction. Press the mask down while lifting the jaw to hold the mask tightly against the face, and give 2 breaths while watching for slight chest rise. Actually seeing the chest rise with each breath is the best way to ensure that your breaths are effective. Breaths should be delivered over 1 second each, with just enough force to produce visible chest rise. Avoid excessive ventilation and pause about 1 second between each breath.
In this practice session, Be sure to hold the mask firmly against the face while lifting the jaw. Also, watch for the chest to rise as you deliver each breath over 1 second. We'll pause here for you to get into position with the mannequins to practice the technique of opening the airway and giving breaths by using your pocket mask with a one-way valve. We'll practice 5 sets of 2 breaths along with the video. Get ready. Begin in 3, 2, 1. Give 2 breaths. Watch for chest rise. Give 2 breaths. Give 2 breaths. Give 2 breaths. Give 2 breaths.
Now let's practice compressions and breaths together by using your pocket mask with a one-way valve. When switching between giving compressions and giving breaths, limit the time between compression cycles and breaths to 10 seconds or less. Make sure the chest rises with each breath, but provide ventilation just to the point of the chest rising. We'll start with assessment and then combine compressions and breaths. We'll be doing 3 sets of 30 compressions with 2 breaths. We'll pause here while you get into position with the mannequins. Here we go in 3, 2, 1.
Hey, are you okay? Are you okay? Help, someone help. Activate the emergency response and get an AED. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 25, 26, 27, 28, 29, 30.
Next time you're gonna get a pitcher full of cold water.
When participants in an event with rescuers from multiple agencies, the real challenge becomes about logistics. In other words, the coordination of rescuers and resources when more people are involved. However, your first few steps are the same.
When you arrive, quickly assess the scene and try to get a response from the victim. If there is no response, call or activate the emergency response system. Then take 5, but no more than 10 seconds to check for breathing, looking for signs that the person is not breathing or is only gasping, and at the same time, attempt to find the pulse.
Move the victim to a firm, flat surface and begin CPR. One rescuer should while the second delivers ventilation. After each set of 30 compressions, the ventilator should deliver 2 breaths. A third rescuer should turn on the AED and attach the pads to the victim's bare chest. It's important to know your AED or defibrillator because models can differ. Follow your device's prompts for the
When the AED signals that it's ready to analyze and that all rescuers must stay clear of the patient, the compressor should switch roles with another rescuer. While the AED is charging, the compressor should take advantage of that time to deliver a few more crucial compressions.
The emergency responder operating is responsible for ensuring that all rescuers are clear from touching the patient to allow for rhythm analysis and before delivering a shock. If a shock is advised, clear everyone and deliver the shock.
As soon as the shock is delivered, rescuers should begin another set of compressions, with a different rescuer delivering compressions and with a feedback device. Continue these steps until advanced help arrives.
Now let's focus on using an AED. Although AEDs may differ slightly, there are 4 universal steps for operation. To begin, turn on the AED, open the carrying case or the top of the unit and immediately power on the AED. Some devices will power on automatically when you open the lid. After that, attach the pads to the victim's bare chest. Use the diagrams on the pads for correct placement. Some AEDs may have adult and pediatric pads. Be sure to use the adult pads on anyone 8 years of age or older. If you're not sure of the person's age, use the adult pads. On some AEDs, you may need to plug in the pads if they aren't already connected.
After you open the device and power on the unit, follow the prompts and place the adhesive pads on the person's bare chest per the pictures on the pads. Place one pad to the side of the left nipple and the other on the upper right chest, directly below the collarbone. After the AED is turned, some units will tell you to press a button for the device to analyze the heart rhythm. Others will analyze the rhythm automatically. The AED may take about 5 to 15 seconds to analyze the rhythm.
The AED will deliver an audible prompt when it's ready to analyze the heart's rhythm, followed by a prompt to clear the victim. Strongly repeat the command to clear, check to be sure that all rescuers and bystanders receive the command and follow it. Once the AED completes its analysis, if a shock is advised, it will charge and then prompt again to clear the victim. You'll repeat the command to those nearby. Loudly state something like, "Everybody clear," and visually check to make sure that nobody is touching the victim, not even the person giving breaths. Then the shock can be delivered.
Next, press the shock button. The shock may produce a sudden contraction in the victim's muscles. After the AED gives the shock, resume CPR immediately, beginning with chest compressions. Do not remove the AED pads or turn it off. The device will analyze and shock cycle about every 2 minutes. Follow the AED's voice prompts. If at any time the AED indicates that no shock is advised, immediately start chest compressions.
You'll need to consider a few special situations when using an AED. First, if the person's chest is so hairy that the pads can't adhere to the skin, you may quickly shave the razor is provided. If no razor is provided and you have 2 sets of pads, apply 1 set to the hairy chest. If the chest hair prevents the pads from contacting the skin, the AED should tell you to check the pads. If it does, press them down more firmly. If they still aren't sticking, rip the pads off forcefully, removing the chest. Then apply a new set of pads to the bare skin.
Excessive water on the victim's chest can also be a problem. It could allow the shock to travel through the water between the pads, ultimately preventing delivery of an effective shock dose to the victim's heart. If the victim is lying in water, quickly move them to a dry area before using an AED. But if the victim is lying or in a small puddle, you can use the AED. And if the chest is covered with water or sweat, wipe it off before attaching the AED pads, but wipe the chest quickly. It doesn't have to be completely dry.
Some people have an implanted pacemaker or defibrillator in the same place where you would put the AED pads. These devices look like or square lump that's smaller than a deck of cards. If you see this lump, avoid putting a pad directly over it. Also, don't place a pad directly over a medicine patch. If a medicine patch is located where you need to place a pad, take the patch off and quickly wipe the chest before applying the pad. If the victim is wearing an undergarment containing medicine, be sure to apply the AED pads on bare skin, avoiding contact with the garment.
You should familiarize yourself with the AED model in your workplace. Regardless of the type of AED, remember to turn it on first and follow the audible prompts that will lead you through the rest of the steps. AED kits may include additional emergency equipment, such as scissors, wipes, gloves, and a barrier device. These items may also be found in a separate emergency or first aid kit.
We'll pause here to allow you to get familiar with the AED in your class today. Your instructor will show you all that's included in the kit and demonstrate the correct way to place the pads on a victim.
What's the first thing you do there? Okay, that is a test question. If they're in the water, what do you do? Okay, if they're sweaty and diaphoretic and all that, what do you do? Okay, those are test questions on your CPR, so you need to remember that. Okay?
Ventilation is critical. High quality CPR, especially in respiratory related emergencies such as drowning, anaphylaxis, and asthma. Guidelines recommend against excessive ventilation during CPR, and research suggests that some rescuers are less confident and less effective when using a bag mask device on their own without assistance. Because the bag mask device is such an important skill and is common in the healthcare setting, we'll work on it now. Bag mask devices consist of a ventilation bag and a face mask, and they come in a variety of sizes. You can also use supplemental oxygen with a bag mask device.
To begin, position yourself directly above the person's head. You'll use the EC clamp to hold the mask in place. To do this, apply the mask by first placing the cushion at the narrow end of the mask onto the bridge of the person's nose. Then lower the mask fully onto the face, watching for the cushion to bulge as it initially seals against the face. Form a C with the thumb and index finger of one hand and press down on the dome of the mask to further seal the rim of the mask. The remaining 3 fingers of that same hand should form an E to reach past the edge of the mask along the bony rim of the jaw. To tilt the head back, lift the jaw toward the mask and open the airway.
Make sure you squeeze the mask with your thumb and index finger while lifting the jaw to achieve an airtight seal between the mask and squeeze the bag with your other hand or push it against your leg or body. If the chest doesn't rise with each breath, you're not providing adequate breaths. If you don't get chest rise, readjust the mask, reposition the head and neck, and try again to ventilate. And then, only if necessary, administer a larger amount of air, just enough to get chest rise.
The critical delivering breaths remain the same for the bag mask device as for the pocket mask. 2 breaths are given, with each breath given over 1 second after every set of 30 compressions. Be sure to deliver each breath over 1 second with just enough volume to make the chest rise. Delivering breaths in this way will reduce the chance of gastric inflation, or going into the person's stomach instead of the lungs. Gastric inflation can cause vomiting and possible aspiration.
If you have multiple rescuers, the most effective way to deliver breaths with the bag mask device is to use the 2-person technique. One rescuer focuses on keeping the airway open and securing the mask, while a second squeezes the bag to deliver breaths, just enough to cause the chest to rise. The first rescuer will use both hands to seal the mask to the person's face and lift the jaw. The thumbs and index fingers of both hands each form a C to seal the mask against the face, and the 3 remaining fingers of each hand will form an E, lifting both sides of the jaw into the mask. Be careful not to press too hard on the mask, which could push the jaw down and block the airway.
Now it's time to practice the 1 rescuer bag mask technique so that in a few minutes, we can combine it with compressions to work on a 2 rescuer sequence. We'll pause here to get into position. Now that we're ready, practice using the bag mask device. Follow along with the video. Here we go in 3, 2, 1. Give 2 breaths. Watch for chest rise. Give 2 breaths. Give 2 breaths.
When the calls are not a pin of the tuition.
And give 2 breaths.
With the sharp.
Yeah.
This is the pen that I bought from the boat dog.
Sometimes treatment for a cardiac arrest may be delayed,
Oh, you got
either
that
because
silly
of
little
barriers to
thing that they got
accessing
in
the
the pack.
victim or because the arrest was not witnessed. Regardless, CPR is still critical.
The earlier a victim of cardiac arrest receives CPR and shock delivery, the greater the chance of survival and recovery. And early CPR has been shown to double or even triple survival from witnessed sudden cardiac arrest.
For many healthcare providers and other rescuers, a 2-person or team rescue is a more common occurrence. So let's first look at the roles for 2-person rescues.
The first rescuer should CPR with chest compressions while counting out loud and delivering breaths. Basically, they're handling the situation at first as a one rescuer scenario. The second rescuer is responsible for powering up the AED and attaching the pads, as well as providing ventilation when a device becomes available. It's important to remember that the rescue compressions should switch roles about every 2 minutes to avoid fatigue and ensure that compressions remain effective. The compressor should pause when ventilations are being given until an advanced airway is secured. The compressor may also need to briefly pause when the advanced airway is inserted. And if you're performing CPR and AED, you should switch roles when fatigued or after every 5 cycles. That's about every 2 minutes. When an AED is present, switch roles every time the AED tells you to reanalyze, or sooner if the compressor is fatigued. This switch should take less than 5 seconds to minimize interruptions in chest compression. We'll learn more about how to effectively switch roles in the team dynamics section.
In 2 rescuer CPR, each rescuer has a specific role. Let's review these roles while watching them play out. Rescuer number 1 should be positioned at the person's side, ready to perform chest compressions and count them out loud. And rescuer number 2 should be at the person's head. It's rescuer 2's role to maintain an open airway and give breaths with a bag mask device while watching for the chest to rise and avoiding excessive ventilation. Rescuer 2 should also encourage rescuer 1 to perform chest compressions that are fast and deep enough and allow complete chest recoil between compressions.
Now let's practice 2 BLS. Follow the video as you practice. We'll work on the full sequence from the point of finding the victim until advanced medical help arrives. We'll pause here for you to get into position for the 2 rescuer practice. Okay, let's begin. In 2, 1.
Hey, are you okay? Are you okay? Activate the emergency response and get an AED. There's no breathing, no pulse. 1, 2, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Dun, 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 dun. I hit play. I got it on my.
No,
Videos are.
It looks like.
Because most cardiac arrests.
10,
happen at
100,000,000,
home, or in a
1,000.
public place and not at work, you may not have access to a barrier device during CPR. This means that you may need to give mouth-to-mouth breaths without a pocket mask or bag mask device. Although we won't practice this, it may be a skill you'll need to use one day. This section shows how to give mouth-to-mouth breaths when a barrier device isn't available.
Mouth-to-mouth breathing is a quick and effective way to provide oxygen to a victim. Each breath you take contains about 21% oxygen. When you provide a rescue breath, that breath contains about 17% oxygen. This is why rescue breaths are effective in providing oxygen.
Let's go through the steps to deliver mouth-to-mouth breaths. Start by holding the person's airway open with a head tilt chin lift. With your hand on the forehead, use your thumb and index finger to pinch the nose closed.
Now, take a regular breath and seal your lips around the mouth, creating an airtight seal. Give one breath, blowing for about 1 second. Watch for the chest to rise as you give the breath. If the chest doesn't rise, repeat the head tilt chin lift. Give a second breath, blowing for 1 second while watching for the chest to rise. If you can't ventilate the person after 2 attempts, check airway obstruction, but then promptly return to chest compressions. Make sure you give each breath over 1 second and deliver air just until you make the person's chest rise.
Today, we've looked mostly at the procedures you should perform when someone does not have a pulse. But you should also know what to do if someone has a pulse, not breathing effectively. When that happens, rescuers should give breaths without chest compressions. This is known as rescue breathing. For adults, give 1 rescue breath every 6 seconds. Also, give each breath over 1 second and make sure that each breath results in visible chest rise. During rescue breathing, you should also check your pulse about every 2 minutes. Get ready. Begin in 3, 2, 1.
Hey. You know all them ones.
Do faces. I also have them.
Give 1 breath.
Their names.
It's probably best to ask Fred.
Give 1 breath.
Yeah.
What?
The names from
You know all their names, but yeah.
Give 1 breath. Give 1 breath.
Is everyone there, right?
Looks like it.
Give 1 breath.
Sorry, come with your name tag, Fred.
That's good.
Give 1 breath. Give 1 breath. Give 1 breath.
Give 1 breath.
Another way to deliver breaths is with an advanced airway. Devices such as laryngeal mask airways, supraglottic airway, and endotracheal tubes are types of advanced airways that are more secure for providing breaths. These devices help prevent gastric inflation and airway obstruction. Placing these devices requires special training that we won't cover in this course, but you should know how to give breaths when an advanced airway is in place. When you provide CPR in an advanced airway, the ratio of compressions to breaths changes. Instead of providing 30 compressions in 2 breaths, you'll perform continual compressions at a rate of 100 to 120 per minute while another rescuer gives rescue breaths. In other words, when an advanced airway is in place, you won't pause compressions to give. This goes for victims of all ages, and not pausing compressions allows blood flow to the heart and brain to remain high.
An opioid-associated life-threatening emergency is one condition that might weaken or stop a person's breathing while they still have a pulse. Opioids are medications used primarily for pain relief. In high doses, these medications can cause a person to stop breathing or can even cause death. Naloxone is a medication that can reverse the effects of opioids and may restore normal breathing. Common ways to give naloxone are intravenous, intramuscular, and intranasal. If you suspect an opioid-associated life-threatening emergency in an adult who is active and isn't breathing normally but has a pulse, you should give one rescue breath every 6 seconds. Then, if your local protocol allows, give naloxone, but do not delay breaths to give naloxone. If the person does not have a pulse, you may give naloxone after starting CPR, but do not delay compressions. For further information on opioid-associated life-threatening emergencies, please consult your provider manual.
What you are about to see will include the portrayal of advanced life support skills. As a BLS provider, you may be on a team with advanced life support providers, but rest assured, those skills are this training. However, no matter the skill, procedure, or equipment used in a resuscitation event, BLS must continue.
Successful teams not only have medical expertise and mastery of resuscitation skills, but they also practice good communication skills and adhere to the key effective team dynamics. Team dynamics is an element of high-performance teams and can be broken down into 3 categories: roles and responsibilities, what to communicate, and how to communicate.
Clear roles and responsibilities should be immediately established by the team leader or the first rescuer on the scene. When all team members know responsibilities during a resuscitation attempt, the team functions smoothly.
The ideal situation is when multiple rescuers work as a team to perform all the needed roles in a resuscitation attempt. This figure identifies 6 possible team roles for a resuscitation. Note that some roles are typically performed by advanced providers. If enough each rescuer takes a role. If the team has fewer than 6 rescuers, some team members may be assigned more than one role. Some roles have a higher priority than others.
The compressor assesses the victim and stays next to the victim's chest to perform chest compressions. When giving compressions, rescuers should switch compressors after every 5 CPR, about every 2 minutes, or sooner if tired.
The rescuer positioned by the victim's head maintains an open airway and delivers breaths while watching for chest rise and avoiding excessive ventilation.
The team member operating the AED or the monitor defibrillator can also serve as the CPR coach. The role of the CPR coach is to focus on team members' performance of high-quality CPR and to provide feedback as needed during the resuscitation attempt.
Every resuscitation team must have a defined leader who assigns roles and makes treatment decisions. Often, the team leader will be at the foot of the victim. However, the team leader may move around to observe and evaluate the team and to provide feedback when needed.
The timer recorder keeps a record of the events that occur, including frequency and duration of interruptions and chest compressions, time of shock delivery, and medication administration. When only 2 rescuers are present, they typically take the roles of compressor and airway, with one of them also covering defibrillator and team leader. If 3 rescuers are present, they take positions around the victim in the 3 critical roles: compressor, airway, and monitor defibrillator.
Every member of the team should know his or her limitations. Team members should ask for assistance and advice early, not when the situation deteriorates.
These impressions related to self after this.
Sometimes a team member or the team leader may need to correct actions that are incorrect or inappropriate. It's important to be tactful, especially if you need to correct a colleague before they make a mistake.
Next category is what to communicate. Knowledge sharing and summarizing information are components of effective team performance. Team leaders should review what's happened and ask for ideas and observations from team members.
That's our second shock. We have 1 milligram of epi on board.
Okay, starting another 2 minutes.
Lidocaine.
Okay, 100 milligrams of lidocaine.
The last category is how to communicate. Communication is the process of verifying that the message sent was received as intended. It also verifies that any assigned tasks have been completed.
This is our first round of CPR. We have 1 shock on board.
The 1 shock on board.
In addition to using closed loop communication, teams should use clear messaging to help prevent misunderstandings. Teams that work together frequently use terms or phrases that have specific meaning for them to ensure clarity among members.
So when I'm ready to innovate, what I want you to do is pull that mask off, but keep it handy in case I happen to miss.
Finally, teams need to communicate with respect. Speak to each other in a professional manner, regardless of scope of practice or expertise. Resuscitation events are stressful and emotions can run high. Understand that this is the nature of CPR and remain focused on the life you're trying to save.
A high-performing team has specific performance metrics, including a high chest compression fraction, or CCF. CCF is the amount of time spent doing high-quality chest compressions during a cardiac arrest resuscitation attempt. You can only achieve a high CCF by eliminating pauses during high-quality CPR.
The Resuscitation Outcomes Consortium trials showed that a 10% increase in CCF is roughly equal to an 11% increase in survival. Pauses typically occur during intubation, rhythm analysis, pulse checks, compressor switches, and defibrillation. We'll address some best practices for eliminating pauses in some of these areas, but you'll also need to measure high-quality CPR metrics at your own place of practice to identify other areas where pauses exist. You cannot improve what you do not measure.
Whenever compressions are paused, compressors should hover their hands over the chest and be prepared to resume compressions.
As a BLS provider, notice that advanced providers check for a pulse, pre-charge the defibrillator, and prepare to deliver a shock about 15 seconds before pausing compressions at the end of each 2-minute cycle. When using an AED, the prompts will instruct you when to pause. For example, during rhythm analysis or shock delivery.
Switch compressors with the second coming in from behind the first. This allows the second compressor to have the same view of the team, and in particular of the AED or defibrillator. For seamless transitions, switching between cycles every 2 minutes is best. However, if a compressor needs to switch because of fatigue, coordinate the switch to happen as fluidly as possible, such as while delivering breaths.
Top CPR, switch. Shocking, everybody clear? Shock, go.
It's a best practice to use real-time feedback devices during CPR. However, if the device isn't available, a metronome can help establish the proper rate. If your AED or defibrillator doesn't have a metronome, you can download a metronome app to your mobile device before the conclusion of this course.
It's not enough to know what to do or even how to do it. To obtain the best results, your team must perform both and the how flawlessly. That requires practice. And effective practice requires measurement. But measurement is only effective if you debrief the team, set goals to improve, and practice more. Again, you cannot improve what you do not measure. For more information on how your team can implement this type, talk to your instructor.
Okay, y'all take 10 minutes. You hear me?
Yes.
Okay. Go.
all your pens around for you. These are my favorite pens, right here. I have every single color. And
Jesus Christ.
I have every single color of these pens.
Were you
And
still
a lot.
on the ground?
Yeah, well, I fell on my chair.
Oh.
And so since I fell on my chair, I just sat on the ground.
Yeah, what's up with that?
Well, I was moving to get up. You know, I was moving to get up and I'm wearing these leggings and I just slid right off the chair. Yeah. Typical.
Alex? You run around the building a couple times? What was you doing last night that you can't stay awake this morning? Huh?
So honestly, because my mother lost bad shirt.
Lost his what?
My brother lost his bad shirt because it misplaced it, and I don't know why he did. Out to his closet, it's never stone is. And we got to spend up all night looking.
Well, you need some coffee? Little caffeine? Go get you a Mountain Dew? Huh? Is that what you need? A little caffeine? Won't you run over and get you a Mountain Dew? You people ain't 20 years old yet. You shouldn't worry about sleep till you're at least 40.
Yeah.
Whose fault was that?
The winter one.
That's good.
Can I put myself through that? I don't call off. I go straight to work. You played a video. For the advanced airways, like the tools I use.
One's an ET tube, one's a supraglottic airway, one's an LMA. It's just three other ways to secure an airway is what you have to be in a paramedic or above to be able to place one. So I doubt it's going to be in your test. What they focus on your test is your heart rate is 100 to 120. That's what they want. You figure out that your patient needs CPR or whatever, you know, they want you to have someone call 911 or someone get the AED, and they're going to constantly get on you or question you about your rates, your compressions 30 to 2, rate 100 to 120. They're going to ask you about what's the first thing you do with the AED? Turn it on. It's going to be redundant, goofy crap. Okay. So every answer on that test that you're going to take Thursday is in this video. So it's all pretty much common sense. Okay. Like your ambu bag. When you put your mask on a patient and you squeeze the bag and it don't go in, common sense. Reposition the head. Lift the tongue off the back of the throat. That's all you're doing. Okay. Just common sense stuff.
Certification somewhere. You gotta scrap it. There's 6 of them, right?
Did you check
Yeah.
Yeah. Yeah, I checked
Thanks.
like
Yep.
2 different emails. I checked everything. And a problem line, they didn't send it to me.
Yeah, it's just common sense stuff, sis. That's all it is. Nothing to it. Y'all get your coordinations so you can paint his face up like Mardi Gras.
Out. And my highlighters, and I had both my lipstick.
This kid is 19 years old. He should be able to go for at least 4 days without any sleep. At least 4.
Oh, so best thing. I also. These.
Those are the ones I would use.
Highlighters.
That too.
What's Sarah's last name?
Let's see,
Why didn't you write it?
I'm not a speller.
I told him either I can get it.
I know it's supposed to be on my.
Yes, she's in the group chat.
What's her last name?
I am going to the group chat right now to look. Is she not on there? No, right there. KLESSIG.
By Eva.
Eva.
Oh.
She's not.
Eva's not in here. What's Eva's last name?
Owens.
Owens. She's not in this group chat.
Okay, well, I think I got everybody.
I just saw it.
What's Lily's last name?
Hey, Dad.
Hmm?
Hey, Dad.
Hey, Dad?
She's not in here
Yeah. I think I could.
Do you want a black pen? I have like 5 of them. Yeah. You like my pen? I have about 30 of these pens at home. They're going to work.
Where'd you work at?
Walmart.
I didn't see it.
Yeah.
It's like twisted to the side.
Got a face paint on the neck. I wish, but no. What day is November 1st? Forgot. Saturday. Huh?
We still have
They're all of this, I don't know.
an hour. We have an hour. I think, wait, what's up with you? Oh, never mind. I think we're supposed to be here till 45. Yeah, it's just because it was the practice.
15 or 16.
They're each like 10.
Well, there's also just the one who's literally just then going, one breath,
One breath.
one breath. It's like that for like 5 minutes.
Does anyone want a green highlighter? I'm not much of a green color.
That's the same course.
That percent.
Like you look at the genders when you say.
Oh, you need like one.
Yeah.
Yeah, that's my same look.
Her words were given to the redheads, they like green.
And go pull a 4-leaf clover out of the grass. You have a 4-leaf clover?
Now, this class compared to the class that I took a couple of years ago, or
EMT is so much better. Like my class was not interactive.
Actually,
Literally, like we didn't do like the group chat, we didn't do anything like that. Yeah. My class wasn't that interactive.
it's boring. Too boring.
Oh, I forgot that's where the black
I
is.
say,
Huh?
I said if you had one here.
Let me see.
Over, but if you had. It's so bad.
Oh, yeah. Oh, yeah. Yeah. Love it. This is a black pen and I was tempted to give it to Scrappy. When you get to that. He does. Oh my gosh. Does he not? You should be like, I found your twin. Just hand it to him. I'm gonna do it. Your twin brother. I'm gonna do it. You're gonna be like, hey, can I put a picture of your twin on a Facebook or pin? I found it. I didn't. I'm funny if someone walked into my room.
Oh my gosh.
Am I wrong?
You know what? My boyfriend's taking my birthday off. My birthday falls. My boyfriend is Mario walking.
Do it.
Oh.
That's.
I mean, Scrappy, you're gonna say nothing. Christian sat through like 4 of his classes. Not good.
Yeah, I know.
I'm sending a picture of my penny collection to Jacob. I bought that from the boat dock. That's the pen I bought from the boat dock. That's why you sent a picture of your boyfriend.
Where's the boat back?
It's the Bolsho's boat dock.
The only one I can think of is around Brand's.
Like, well, that works. Well, this one Bolsho's like right over. That's the pen that I bought. That's the best.
For me, it's kind of like the kitchen. So, it's just the parking lot is like. Yeah.
You just reminded me to send a picture like that too. I found Scrappy's twin.
That sounds really good right now. I feel good when she looks back.
I'm sorry. Not a deal. I thought so.
Sounds really weird. Classics the best.
I like sweet pickles.
Meat pickles, that's how you're, the sweet pickles are good. But like, pickle chips. And those are really good. I wanna try like the pickle chips that you can get on. Ooh, got this.
Oh,
The crazy one where I was like,
I found Scrappy's like, right.
I've been having to order them. I think we should try them.
I found Scrappy's twin.
Yeah.
I'm gonna take it to him. I'm gonna be like, hey Scrappy, they put your face on a pin. Hey Scrappy, did they put your face on a pin?
What, some asshole?
Is all them back in there? I can't.
No, we're still missing.
I don't care.
Okay, that sounds like. He told me he was still listening.
The ideal situation for performing BLS is having a team of multiple rescuers who can perform all needed roles.
On top.
Your team will be asked to treat a cardiac arrest victim. Your instructor will read and assign a role to each of you. These roles include team leader, compressor, airway, medications, monitor defibrillator, and timer recorder. Some team members may be assigned multiple roles. This scenario will run for 10 minutes with the goal of providing high-quality CPR and enforcing the principle of the effective teams. This exercise is purely practice and not a test. The exercise will, however, reinforce skills performance and improve the overall resuscitation provided to the patient.
To evaluate the resuscitation, your instructor will be looking for high-quality CPR, which includes compressing at least 2 inches or 5 centimeters on them at a rate of 100 to 120 per minute.
That will be
Allowing
on your
complete
test.
chest recoil between compressions and avoiding excessive ventilation. Another critical component of high-quality CPR is minimizing pauses in compressions. So your instructor will be measuring chest compression fraction, or CCF.
CCF is a fraction of time during a resuscitation attempt when the patient is receiving chest compressions. Fewer interruptions are associated with increased ROS and increased likelihood of survival to hospital discharge. Targeting a high CCF is desirable for survival outcomes. A chest compression fraction of at least 60% is recommended, and a goal of is often achievable with good teamwork. At the end of the exercise, your instructor will conduct a debriefing session to determine where improvements could be made in future attempts. Now that we've covered adult BLS, let's discuss BLS for children. It's difficult to imagine a child being a victim of cardiac arrest, but it certainly happens. Pediatric cardiac arrest isn't as common as adult cardiac arrest. In adults, the cause of cardiac arrest is often cardiac related, but in children and infants, cardiac arrest is often due to respiratory problems, such as airway obstruction, drowning, opioid or seizures.
There are some differences in BLS for children, including the chains of survival. Like the adult chains of survival, the pediatric chains have 6 links. Both pediatric chains include prevention of cardiac arrest, activation of the emergency response system, high-quality CPR, and resuscitation, post-cardiac arrest care, and recovery. In a hospital setting, the difference is the first link. It focuses on early recognition and prevention of cardiac arrest, which emphasizes patient monitoring and assessment.
Before we get to the practice, let's talk about a few important differences between BLS for children and BLS for adults. First, under the AHA BLS guidelines, anyone from age 1 year old to puberty is considered a child. Under these guidelines, puberty is defined as chest or underarm hair on boys and any breast development on girls. When you're performing compressions on a child, it's fine to or 2 hands, whichever works for you and allows you to provide deep, effective compressions.
To be effective, your compressions must go to a depth of at least 1/3 the depth of the child's chest.
That is
That's
on your
approximately
test.
2 inches or 5 centimeters. And the chest must recoil completely between compressions. Also, whether the victim is a child or an adult, a single rescuer always uses a compression to ventilation ratio of 30 compressions to 2 breaths. However, if you're a 2 rescuer team and the victim is a child, the ratio changes and should be 15 compressions to 2 breaths.
It's important to note that giving breaths to children requires less volume than giving breaths to adults. Breaths that are too large or forceful have greater potential to cause lung trauma in children than in adults. However, you still need to provide enough air to see the chest rise.
Another difference is when to activate the emergency response system. If you do not witness the arrest and you're alone, you have 5 cycles of CPR to deliver oxygenated blood.
That
to the
is on your
brain
test.
before you activate the emergency response system. If the child has an adequate pulse but is not breathing normally,
You're
it
alone.
may be due to a respiratory problem, so you must provide rescue breaths. Deliver 1 breath every 2 to 3 seconds or 20 to 30 breaths per minute.
And witness a sudden arrest, leave the child so that you can activate the emergency response system and get the AED.
That is
Then
on your
return
test.
to the child to perform CPR and use the AED.
Now, let's combine the BLS skills that you've learned for adults with the differences we just reviewed to practice BLS for children. We'll practice 2 rescuer child CPR by using a 15:2 compression to ventilation ratio. One person will provide compressions while the other delivers breaths with a bag mask device. We'll pause here while everyone gets into position.
So let's count down to and get started with 2 rescuer CPR for children, starting with scene assessment. To stay together, follow the prompts on the screen. Let's go in 3, 2, 1.
Hey, are you okay? Are you okay? Activate the emergency response and get an AED. There's no breathing, no pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
'Here's a fact about cardiac arrest. Between 75 and 80% of all out-of-hospital cardiac arrests happen at home. So being trained to perform CPR, whatever your profession, can be the difference in saving a loved one. And we never know who a victim might be. Cardiac arrest can occur in anyone, regardless of their age or perceived health.
Rescuing an infant can be completely different from rescuing an adult, but the principles of CPR for infants who are younger than 1 year old are essentially the same as for adults. There are just a few differences, but those differences are significant.
So let's take things in the same order we use for adult CPR. Right now, we'll talk about the skills for 1 rescuer and 2 rescuer. But this time, we'll first learn to check for a brachial pulse. Then we'll cover infant compressions, followed by giving breaths with a bag mask device. Finally, we'll combine all of these to practice 2 rescuer infant CPR.
First, if the cardiac arrest is witnessed, check the infant for a response and breathing. If it's unresponsive and isn't breathing or is only gasping, send someone to activate the emergency response system and get an AED. If you're alone and don't have a mobile phone, take the infant with you to phone emergency services, or if necessary, leave the infant and find a phone. But if no one witnessed the infant's collapse and there's no response or breathing, or a brachial pulse immediately. If you do not detect a pulse, perform 2 minutes of compressions and breathing before activating emergency response, if it hasn't already been activated.
That is
If
on
the
your
infant has
test.
an adequate pulse but isn't breathing normally, rescue breaths may be required. Deliver 1 breath every 2 to 3 seconds, which is about 20 to 30 minutes. Check an infant's brachial pulse. First, place 2 or 3 fingers inside of the upper arm, between the elbow and shoulder. Then, press your index and middle fingers gently against the inside of the upper arm for at least 5 seconds and no more than 10 seconds. If there is no pulse, or if the heart rate is less than 60 per minute with signs of poor perfusion despite adequate oxygenation, begin CPR.
That is on your test.
To begin CPR, there are 2 options for hand and finger placement when performing compressions on an infant. The first technique is to place the tips of your 2 fingers on the sternum or breastbone in the center of the infant, just below the nipple line, but be careful not to press on the bottom of the breastbone.
The other is the 2-thumb encircling hands technique. Place both thumbs side by side in the center of the infant's chest on the lower half of the breastbone. In very small infants, your thumbs may overlap. Don't apply any pressure on the tip of the. Now, encircle the infant's chest and support the back with the fingers of both of your hands. In this position, both thumbs will be used to depress the breastbone.
Whether using the 2-finger or 2-thumb encircling hands technique, once in the correct position, push hard and fast to a depth of at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters. And the rate needs to be at
That
least
is on your
100 to
test.
120 compressions per minute. After each compression, allow the chest to recoil completely.
As we get ready to practice infant chest compressions, remember these key points. Deliver compressions at the rate of 100 to 120 per minute. Depth of the compressions is at least 1/3 the depth of the chest, or approximately 1.5 inches or 4 centimeters. Allow the chest to completely recoil after each compression, and count out loud as you deliver 30 compressions. So let's get into position to practice compressions. Let's go in 3, 2, 1.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 'Now, let's look at the delivering infant breaths with a bag mask device. This is similar to the adult bag mask technique we practiced earlier. 2 things to note before you start. 1, make sure you have the right size mask so that it isn't too big or too small. And 2, remember that chest rise is the most observable sign to determine the effectiveness of your rescue breath.
First, position yourself directly above the infant's head. You'll use the EC clamp technique that you learned earlier. But be aware that if you tilt or extend an infant's head beyond the neutral position, the infant's airway may become blocked.
Ensure a tight seal between the mask and the infant's face, and squeeze the bag with your other hand to deliver just over 1 second to make the chest rise. If the chest does not rise, then you're not providing adequate breaths. Adjust the mask, reposition the head and neck, or administer a larger amount of air.
Now, let's practice 5 sets of 2 breaths. Deliver each breath over 1 second. Deliver just enough breath to make the chest rise, and a tight enough seal with the mask on the infant's face. We'll pause here while everyone gets into position. Follow along with the video. Here we go in 3, 2, 1.
Give 2 breaths. Give 2 breaths. Give 2 breaths. Give 2 breaths. And give 2 breaths. To practice 2 rescuer infant CPR. But before we begin, let's note a couple of differences between 1 rescuer and 2 rescuer infant CPR. One difference is the hand and finger placement for giving compressions. In 2 rescuer CPR, the person doing compressions should always use the 2-thumb encircling hands technique.
The other key between one rescuer and two rescuer infant CPR is the compression to ventilation ratio. As mentioned before, instead of a 30-to-2 ratio in a one rescuer situation, two rescuers should use the ratio of 15 compressions to 2 breaths.
Okay.
So let's practice compressions for two rescuer CPR. As a reminder, make sure you're 100 to 120 compressions per minute. Use a 15-to-2 compression to ventilation ratio because you have two rescuers. Make the compressions approximately 1.5 inches or 4 centimeters deep. Allow the chest to fully recoil after each compression and count out loud for your partner.
Time to practice two CPR, starting with scene assessment. We will pause here while you get into position with the mannequins.
This is. This.
Like, I'm just gonna shut up here.
Oh, this is fancy.
This.
Like, no, that's.
Here we go. In 2, 1.
Should like move the mouse real quick.
There's 6 left after this one.
Hey, are you okay? Are you okay?
Thanks.
Mm-hmm.
Good.
Activate the emergency response and get an AED. There is no breathing and no pulse. 1, 2, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 5, 6, 7, 8, 9, 10,
You were.
11, 12, 13,
Okay,
14,
bye.
15.
That doesn't mean I'm sleeping.
You need to pay attention.
Still here.
You just need to pay attention and watch it, because these are gonna be on your test.
It's just in time. I'm about to change it again.
So close. It's
Like I have.
There are some differences when you're using an AED for infants and children younger than 8 years old. Some AEDs can deliver either an adult shock dose or a child dose for children younger than 8 years old. A pediatric capable AED will have features that allow appropriate shock, but the available features depend on the type of AED you're using.
Your AED may also include smaller sized pads that are designed for children younger than 8 years of age.
Remember
If it
that.
does, use them. If not, use the adult pads, but make sure that they do not touch or overlap. But never use the child pads for an adult. The delivered by child pads is too small for an adult and likely won't be successful. It's better to provide high quality CPR than attempt to shock an adult with child pads. Some AED pads recommend placing one pad on the chest and one pad on the back for infants and children. Follow the pictures on the pad packages for proper placement.
If an infant defibrillation, a manual defibrillator is preferred. But as we mentioned before, this device is quite different from an AED, and it requires special training that is not included in this course. If a manual defibrillator is not available, an AED with a pediatric dose attenuator is preferred. But if neither is available, you may use an AED without a pediatric dose attenuator.
The reason they tell you that is when you defibrillate a child or an infant, it is so many joules per kilogram on the monitor as far as actual dose of electricity that you're giving them. So if it's 2 joules per kilo and they weigh 15 pounds, half of there's 2.2 kilograms in 1 pound. So 15, say they weigh 15 kilos, which is 30 pounds, right? So you give 2.2 times 7. So, or 7.5, because 7.5 is half of 15. So 2 times 7. you will deliver probably 2.2 times 7 will be 2 times 7 is 14.
Yeah, it's 14.
Almost 15 joules. Okay, so you have to program that into the cardiac monitor. You know, you'll set your voltage at 15. So with the AED, when you plug in that attenuator, it will only give a weaker dose than you would give a human, because a grown person. So start out getting defibrillating them, you start at 200. It's 200, 200, 360. Or 200, 200, 300 now. Okay. For an adult. So that's why they want you to use that little attenuator for children and infants. But reduces the dose of electricity that this child or infant is going to receive, because they don't require as much as an adult. So when they say that you can use the adult pads on a child or an infant, you put one on the front, one on the back. That way it's slapping the heart like that. Okay?
Yes. That makes
Does that make sense?
It's like a sandwich.
So if you don't have the child or the infant attenuator, use the adult pads. They're gonna get the adult dose, but still, electricity is electricity. You know, a lot's better than none. You see what I mean? To get the heart out of VFib or pulseless VTAC, because when they're in VFib, the muscles of the heart are just sitting here doing this. They're just like a seizure. They're not actually pumping blood. They're just sitting there doing this. You see is the electricity going on. You don't see the pump action on the monitor. And the defibrillator, it will pick that up. It's only, it is designed to do VFib, pulseless VTAC. It'll also read a systole. That's when it will tell you do compression, because there is no viable contraction going on. You see what I mean? It's programmed to do this, to pick up what the heart is doing. So if it's not beating, it's going to tell you to do CPR. If it is sitting there doing it like a seizure, that's when it's going to tell you shock is at. Okay, when you clear your patient, you will say, clear you, clear me, clear head, clear feet. You'll make sure ain't nobody around or touching the child or the infant or the adult when you defibrillate, and then you shock. Okay, when they say that the muscle contraction will happen when the electricity dose is given, believe them. Okay, I've had them jump 6 to 8 inches off the cot. Some of them just sit there and they'll do like this, and some of them will actually, it's enough electricity that will set them up a little bit, and then they go right back down. Yep. How about y'all up north? You hear me? Yes? No?
Yes.
Okay. Did y'all hear every time that I've said this will be on your test? Did you?
Yeah. Yes.
Okay.
When food or other items block a person's airway, choking occurs. In a severe airway obstruction, the person usually has signs of poor air exchange and breathing difficulty, such as a silent cough, an inability to speak, or cyanosis, that is, turning blue. Adults or older children who are choking may clutch their neck with both hands, making the universal choking sign. If someone indicates that they are choking and cannot talk, you must act. For someone who is standing, you'll perform an abdominal thrust.
To perform an abdominal thrust, stand behind the person and place your arms around the waist. With one hand, locate the navel. Then make a fist with your other hand and place the thumb side of your fist against the person's abdomen, just above the navel and below the breastbone. Grasp your fist with the other hand and press your fist into the abdomen with a quick, forceful upward thrust. Repeat thrust, object is expelled from the airway or the person becomes unresponsive.
If you can't wrap your arms around the waist because the person is pregnant or overweight or simply can't stand, wrap your arms around their chest and give chest thrusts instead of abdominal thrusts.
If you're not able to relieve choking in an adult or child, or if the person becomes unresponsive, have someone activate the emergency response system. Then lower the person to the ground and begin CPR.
Perform CPR as usual, but with one difference. Each time you open the airway to give breaths, look for the obstructing object in the back of the throat. If you see an object that can be easily removed, carefully remove it, but do not perform a blind finger sweep because this may cause the object to become lodged farther back in the airway.
Choking is also a fairly common emergency in infants. The steps to relieve choking in an infant are quite different from older children and adults. If you find an infant who is choking but is still responsive, first sit or kneel with the infant in your lap. Hold the infant face down and resting on your forearm with the head slightly lower than the chest. Support the head and jaw with your hand. Avoid compressing the soft tissue of the infant's throat.
Then rest your forearm on to provide support. With the heel of your other hand, deliver up to 5 forceful back slaps between the infant's shoulder blades. Deliver each slap with sufficient force to attempt to dislodge the foreign body. Then place your free hand on the infant's back, supporting the head with the palm of your hand. This will cradle the infant between your 2 forearms as you turn the over while carefully supporting the head and neck.
Keep the infant's head lower than the chest and deliver up to 5 quick downward chest thrusts in the same location where you would perform compressions, just below the nipple line, over the lower half of the breastbone. Do this at the rate of about 1 per second. Repeat the sequence of 5 back slaps and 5 chest until the object is removed or until the infant becomes unresponsive.
Now that you're in position, let's begin. Follow along with the video as you practice. Here we go in 3, 2, 1. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4. 1, 2, 3, 4, 5. As with an adult, if a choking infant becomes unresponsive, shout for help and have someone activate the emergency response system. Then, face up on a hard, flat surface. You'll perform CPR as usual, but with one difference. Each time you open the airway to give breaths, look for the object.
To give breaths for an infant, the mouth-to-mouth and nose technique is preferred. For this technique, you will first open the infant's airway with a head tilt chin lift. Then place your mouth over the infant's mouth and nose to create an airtight seal. Give 1 breath, blowing for about 1 second. Watch for the chest to rise as you give the breath. If the chest does not rise, repeat the head tilt chin lift to reopen the airway and try to give a breath that makes the chest rise. If you cannot cover the infant's mouth with your mouth, use the mouth-to-mouth technique instead. The mouth-to-mouth technique for an infant is the same as for an adult.
If you can see the object, carefully try to remove it. Never perform a blind finger sweep. You should only try to remove an object if you can see it. If you're alone, after about 2 minutes or 5 cycles of CPR, activate the emergency response system. We'll pause here while you get into position to practice with the infant mannequins. We covered a lot today. You learned the proper BLS rescue techniques of CPR, the use of an AED for all age groups, the importance of effective teamwork, as well as how to perform in a one rescuer or two rescuer scenario. You've also learned rescue breathing and what to do for someone who is choking.
Thank you very much for your time and attention today, and especially for your commitment to learning these critical life-saving techniques. We appreciate and honor the work you all do as healthcare professionals.
Y'all got that?
Yeah.
What mannequins have y'all got up there?
Just like just the adult ones.
Do what?
Just the adult ones.
Is Miss around?
What?
Is Misty with y'all?
No. Do you want us to go get her?
I want you to practice. Can you do that on your own until till it's time for you to go to the next class?
Yeah.
Because I will be. You understand?
Yeah, what'd you say? What was that last part?
I will be watching you. Do you understand?
Sounds good. Yeah, sounds good.
Okay. So take 5 minutes. And y'all are gonna practice everything on the adult. And then Thursday, I will give y'all a little time to practice. And then you will do your practical, and then you will take your written test, okay?
Okay.
Now, you gotta remember things that I said are going to be on that test, or they're going to be on that test, okay?
Okay.
Now, does she need to come and babysit you, or you're going to be grown enough to do this on your own?
I think we're gonna have to do this on our own.
Okay, I'm going to be watching. These guys in here are going to be doing it too.
Okay.
So take you 5 minutes, and then when you come back, I'm going to be watching each one of you do this to make sure that you're doing it right.
Okay, sounds good.
Okay, so take 5 minutes and then come back and we'll. You two come with me.
I got it down into the group chat. I'm sorry that the front page is going to be a little funky and everywhere.
You know how like does it roll down your sheet? Yeah, go back in and then I right click. And I hit reload frame. Huh. And then reload.
Yeah, I still
Yeah, but then this is when you do this, you don't have to skip the question. Oh. So.
group chat. Hey, who is not in the group chat?
They're like all gone too.
Oh my god. Oh my gosh, stupid things, stop it. I will. Description, everything, right? And while I'm over at the cafe waiting for my dad, so. I don't want to get the 12th edition of the book.
Oh wait, I forgot to upgrade the order. Never mind.
Yeah, I have to order it, but I can't do that in my next paycheck. I'm negative on both my parts.
Dang.
Serious. Except I think my other car finally got fixed. Hopefully send something. That's it.
Like, you can, you have 25 cents, you can get like a gumball somewhere.
Alright, come here, child. Oh, you just.
Oh,
He lost his arm again.
And he's dead.
Also, Nichols.
Scary. Why didn't you scare me?
Look.
Scared all of us with that.
Yeah,
Yeah,
remember.
you scared Christian, you scared Jack.
I'm not a child. My water ain't as much as it used to be. I also need batteries.
Looks, I'm like focusing on the video, I'm trying to focus on this. Let me do this.
Thickness of this book made that noise. It's louder than this one.
Because it's still cardboard smacking back of this.
Like, seriously, that is louder than this book. And I don't know how the thickness of this one. Yeah. The fat buttons are. Oh, it's awesome. Stare like. Like, keep rather.
This one's missing. Oh, I think you're nothing over here. It's not like what?
You would try.
You wouldn't feel 200. No.
I've lost my train.
Alright.
I was too real.
I know, it's not.
There's this fun. I gotta clean, I will crack
You know how like that slow big candies and you're like,
There's-
dude, I was so mad. Dude, what do I was like, he's gonna like.
Oh, this is gonna be weird to say that.
Yeah. Shocked the crap out of me. One of my buddies did that. I was having a long day. And I was like, okay, sure, I pull out the shock and I'm like. They're alive.
Alright, well, we can see them. Partner up, go to town.
I tilted the camera over there so you can see. No, do you like this? I hit it.
Like I say, y'all can't do it if you're. We have to do it for.
Yes, we're going, yes. What do you? Are you taking that? I'm not. I only got three.
No, there's not. I thought there's only one for some of it. This is very small. The heck?
I watched you. Get the 80. Gotta get the AED set for y'all.
That's not worked on this, that's why I was checking.
All you got that.
Well, there's only one, so that's why I was just.
I think we'll see if I can find it.
This room is very. Yeah, we'll go over there, it's very exciting. Hey, we're seeing it. Okay, you.
No, I.
Somebody-
I have all adults.
Okay.
All of you guys, it's on my cheese.
I think you're just. This is very similar, this is. This is so.
And I need AED. Hard. You wanna do it first?
Pull red handle to open that.
I'm saying that. Sorry.
Use one hand on it. Supply pad to very begin, exactly as shown in the picture. Press pad firmly. Seal other pads off the plastic. Supply pad to very begin, exactly as shown in the picture. Press pad remove all clothing from patient's chest.
I'll turn it on first, actually, I got that, I'm saying, does it look like this? It's
Yes. Like the other ones.
Pull red handle to open bag.
You don't want to. Yeah, right here. It's on,
Action on pad.
that's on, right?
Peel one pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Peel other pad off blue plastic. Apply pad to bare exactly as shown in the picture. Press pad firmly. Peel one pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Peel other pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. If pads are applied, check connector.
You just have like pretty much.
Peel one pad.
No. Place your pad, like you would, and you go through your steps, got the guide, did your CPR. And all that. So, yeah.
Call for help. All clothing,
I think he said he was gonna find them.
Trevor, you can find another AED.
Woman?
You know the.
Yes. Stand by.
pull red handle to open bag.
Hey, you want
Stealing like he was about to get this in his morning.
You scared? Come here. I gotta say it yet. Okay.
Do CPR, you wanna?
Yeah. And then we'll do the name.
It's already.
Yeah. Third, the leg.
We just have to figure out where to plug it.
Yeah.
But it was both different.
Alright, Sam, look safe. Hello, you awake?
No response.
No response.
Thank you.
Breathe in.
It should already be on. I think it is on. You just have to start compression. Yeah. No.
Let's see that. Okay, so you're right on.
Yep. See, say.
Dave.
Hey, sir. No response. Someone called the emergency medical. Of response. The AED. Okay. So.
We need to. We got another hour.
For help now. Remove all clothing from patient's chest. Hold red handle to open bag. Look at picture. Peel one pad off the plastic. Apply pad to bare skin, exactly as shown in the picture. Press pause for help now. Peel other pad. Remove all clothing from patient's chest. Apply pad to bare skin, as shown in the picture. Press pad firmly. Peel the red handle to open bag. Remove. Ready? Look at picture on pad. Peel one pad off blue plastic. Pad to bare skin, exactly as shown in the picture.
Okay, so let's
Press pad firmly. Peel other pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly.
Okay.
Remove all clothing from patient.
Yeah, I'm just gonna check you out. Checking respiration.
I cannot hear you, count out loud.
It said he can't hear you, Karen. You're so good, son. You're here.
This?
Yeah.
Puppy?
Basically, yeah. Then we flip him over. Then he goes up on his head.
Yeah.
Yep, just like that. Almost.
And what?
Yep. Right where you do compressions. 1, 2, 3, 4.
What?
Always pressing it down.
Alright. I say.
I'm sorry.
Oh.
Came wrong.
You're using that maybe.
I was practicing choking.
Here, you want
Switch, I'll take lead and then you'll take lead the next time. You say, all right.
Unless that's.
Yeah.
Hope the baby come out. All right, you'll do the base. We just arrived.
Remove all clothing in patient presence. Pull red handle to open bag.
Read that. Slide.
There's two people.
Look at the pad.
Yeah.
Peel one pad off blue plastic. To bare skin, exactly as shown in the picture. Press pad firmly. Peel other pad off blue plastic. Apply pad to bare skin.
Hey, do you want us to charge? So that way.
Yeah.
Yeah. I don't think they're very much used. Does Mike go up front and run it back?
Pictures.
Picture's the same.
I know, I realize.
Okay. Oh, the heart. Oh, I get it. Yeah. This image.
For help. Remove all clothing from patient
All I did was pick it up. Over there. Why is it so?
Because I slowed down and it was green.
Nicole. I walked away.
But it's sort of confusing.
Oh, yeah. Yeah, that's not the CPR.
Okay.
14-year-old.
I call.
Yeah.
Where's that baby?
You were on the ground, but I'm trying to talk.
Attention to that.
Let's get her.
Rip his apart.
Yeah, you have to go at like, no, yeah.
Mason, you awake? Mason,
It is.
Yeah.
Yeah, I'm watching.
And I wonder if he's gonna get some. Like this.
Yeah, do this one for children with 2 people. If you're by yourself, you can play with 2.
But with the infant, it's going in.
Stay safe, start to grow. Never contribute both in breath. No breath that you would add, say, starting, emergency. When giving.
Maybe 80.
Yeah, 80. Sorry.
And I would say like checking respirations and heart rate for at least 5 seconds. Big emergency. Like calls 911 stuff.
What is it? I think.
I need 80.
Probably more like 80.
So starting at.
Okay. Stay safe. Start hearing, okay? No response. Start taking your heart rate and breath. Start, if I help them. No heart rate or,
And I say,
breath. I need, start emergency response sequence. Starting, give me an 80.
But this is separate from the.
I'm so sensitive.
I'll remember, you better be practicing and making it perfect, because when I test you, if I'm not satisfied with the way you're doing it, I will flunk your butt. I don't care.
It's just saying that I.
That's not how you should swallow. Yeah. You do this one, give a breath.
Since we all saw that.
Huh?
If you go over here.
8-year-old, look at my ass.
Like if one was a team leader, breath.
I did my trying to get started. Really, really gently.
Cause I remember it. We all remember. How many compressions would you person recited?
One, for infant, it's.
just making sure you guys are as smart as possible.
I
Can you do it?
got it.
Fun.
Let me play with it for a little bit, okay? First and middle.
Got it.
See? You didn't let me know this.
Yeah, better.
Two breaths. One, be right.
Yep.
Now, making small closing from patient's chest. Red handle. Peel one pad off blue plastic. Apply pad to bare skin, exactly as shown in the picture. Press pad firmly. Peel other. Peel one pad.
The same day. Five seconds to look at that. No pause, no breathing, starting compression.
I don't remember.
So what do you want to put your hand on the baby? Right? Sticking it right? Or you putting the hands on the baby and still moving the hands.
First year, no, but, yeah, the person doing the airway. Unless you're one person. So I'm back.
In the video, pretty sure it said you do 5 or 2 minutes of CPR, and then you go to this and you drop. Right? Yeah. Yeah, 2 minutes CPR, then the AED, if you're by yourself. Yeah. And then with the baby, you're by yourself. You do CPR, same way you CPR for 2 minutes, no response. You leave the baby, call emergency services, continue CPR.
There you have it.
You think he's the actual.
Yep. You look like you did it right, or sir.
But
This one's a little.
4, 5, 6, 7, 8, 9.
you got him
Oh, yeah.
behind you.
Oh, that's actually right.
Yeah, he's actually right.
They all do.
I don't know if the baby does.
It does if you put it on first.
EAM, OC, S, C, E, T. I was like.
It's practicing.
Call for help.
Practice.
Okay, I need to.
With the babies, if you can't sit or touch their eyes, lift their head up.
Where's Sarah?
Sarah.
Feel their hide,
Yeah.
feel there, put your mannequin
Pull red.
out here where I can see it.
Open bag.
What do you say? The man doesn't see it. Yeah.
Keep pushing.
Place one pad
Oh.
on blue plastic. Apply pad to bare skin, exactly as shown in the picture.
There you go, right in front of that camera, get with it.
Heel other pad. Apply pad to bare, exactly as shown in the picture.
Oh, wait. Oh. Sarah, you don't have to do it.
Remove all clothing. The patient's
See you do it, Sarah, come on.
Okay, the assigned team said. Check your sponsor. Taking your apartment for selection. Five seconds to work this kind of fairly good.
But see,
exactly as shown in the picture.
Medical emergency.
Apply
Yeah, the baby's not, but the other baby may be in test.
Starting that pressure.
There's no way for it to rise.
this one,
Wow.
And for 1, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 25, 6, 7, 8, 9, 3.
You done?
they watch.
Are you okay? No.
You done that? We'll stay here and do this. Two boys.
Put the AP back. Keep doing the questions, I guess.
I figured out how to play it. We're just checking it out. Their mannequins have wings. They can read here. We're watching the bag and play inside them. That one don't have one.
You not think I'm serious?
Who? Honey, I don't know. I don't know.
She gonna find out on Thursday.
I know you're serious. You have a serious look on your face. Got that look like you don't fuck around.
One, two, three, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14.
There we go, yeah.
Did you get it?
Yeah, I mean, it's kind of like, break it. Break it. Like, do that.
Okay.
Don't say like, like.
All right.
Because I have to like press forward and then.
That means everything too.
Yeah.
I go to regular person, 6 seconds. I like babies, that just goes out.
When you do a baby, I know if it's not getting it right, barely lift the head. This one don't have that like that one that encourage words team. No bag. It doesn't have the bag, but.
No.
So you
I have to like do like.
So what I did, I got it here, I press forward, into the leg and press. Oh, stay on the way I did it.
So in the CE group that, so you did it yourself. All, there's one they say CE, C, Use this here. Chin.
I think so.
The chin with the fingers that look like an E. Hold this down. C.
With babies, when you're doing it. Barely.
Let's see the chest round.
C.
Use that, my knees are sweating.
Yeah, you just have to.
What, y'all doing surgery up there?
What?
You doing surgery?
Yeah.
Yeah. Make it quick. I want to see compressions. I don't want to see surgery.
You're like tape my hands. Okay, see, I'm ready to take. You're supposed to be doing them too.
We have to just.
We touched the most. Now,
Okay, then say what you're supposed to say.
Go
ahead. Go ahead.
Why aren't you doing it too?
I already have it. I have
We
it.
haven't been doing it this whole.
I have it now. Go ahead for that. Okay, then do it. Correct.
Team say, are you okay? Help. Checking, full, responsible, not responsible. Pulse and breathing. Okay, stop that. This is making me mad. No, let us get it, you took the mask.
It's a Thursday, we're taking the written.
You've been
The actual CPR.
You're doing the CPR and then you're doing the written.
See, it's PSI. Checking for responsiveness. No response. Help. Checking respiration. Breathing for at least 5 seconds. Still not contact. Emergency medical response systems. I need an AEG. Starting compressions.
What are you supposed to do?
And we're lost.
Say everything out loud.
Like after the. Yeah.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11,
We got removed all clothing.
What's your top?
Alright, clear. Shock ready. Clear. Stroke.
Pictures on pad.
4, 5,
Use one pad of blue plastic. Apply pad to exactly as shown in the picture. Press pad firmly. Apply pad.
He's alive. Understand it?
Yeah. 5 on the back, flip, 5 on the front.
Sit down.
Yep.
You always check the airway.
Oh, yeah.
Yes, I feel safe.
Yep.
Sir, can you help me? Help. Check, no response, checking hold and on our base, 5
You
seconds.
put in the barely above their heads because of
No,
hospital.
or emergency response movement, starting fresh. Give me a take.
And you don't have the. And then you put these front back, yeah.
Yeah, like it's him.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
I was organizing.
Oh, we got lots of
Yeah.
responses too.
You don't talk because they can't understand, so you just tickle their.
What was you want?
And then
And you try to call them. You've got brains on all these guys.
I get it. I remember.
And then check their pulse.
Yeah.
It's afraid to be lost, you know, if I go see paramedic. I think eventually,
You know, they need to go.
Yeah.
get a little more experience in the field. Or else I try to do that, learn what I'm looking and seeing for.
See what I sent out for.
I've seen, I know what it's.
You just have to show that it's right to.
Bro, that's what I know what the patient, when that's changed.
Be safe.
Body because we don't play, so they're gonna bring on 1 through 6, because those are due Wednesday.
No, it doesn't.
And next thing I knew, levels got, and those two were shut down, and it's like, oh.
Oh,
No, I just have, I believe you see.
Non-responsive,
Ah.
no fault. Emergency, medical response at
I tried to make sure you have somebody speaking about it.
Make sure that nothing, you know, ends up causing further damage.
Top five, shocking.
You're doing
That things like that.
when you're doing that.
I think, you know, it's like.
Yes. Doing that, you say that you're gonna wanna administer AED, the person grabs right here, and you're flipping them over.
Because you're wasting.
Gosh. That was around my, I saw his stuff, she saw it. Something else. Oh!
You don't have to wait for that act, but we play it.
I couldn't watch it.
Oh, by the way, let's listen.
You push that first.
Like, once you see that, it's like a hot concern.
And here's another one for this one.
Push it out.
You bothered me, go fall asleep. Oh, you walked out. Oh. Yeah, you walked out. Why?
Because he's, and he's Furby and Dowsy, or Dowsy, whatever the second one.
Maybe reverse on them. He was asleep. It's his own fault.
Well, like we didn't warn him.
Mm-hmm. It's like this.
Every day.
I want to do it, my grandmother, just let me in class.
I don't know.
I didn't mean to scare the entire class with the book.
Okay.
You go.
He was
I
warned.
like how they're coming like 5 times. I like how they're done. No sleeping. What did he do?
All day, from the top. Same thing.
But.
Okay. No response.
Nicole, I'm listening.
Help out. Hold for 5 seconds, no more. Hold steady, breathing.
I think that's one of my.
Help hold your breath. Starting emergency.
It's not gonna be gone.
580.
Also, very, I think for the next, you didn't like.
I use this in the yesterday, and everyone liked it. What is it?
And my dad did. Before this started to get him certain things, we got this.
Getting it done?
That's brand new. The word? Yeah.
Sorry, I'm very respect my car.
Yeah.
Golden.
Go.
Right there.
I like it.
Golden chicken.
Huh?
Good.
Yeah.
You gonna be able to pass
Yeah, really.
Thursday? I don't wanna see hope, I don't wanna hear hopefully.
Yes, yeah,
Yeah,
During COVID.
yeah.
okay. What time do y'all go to your next class? Huh?
Happy days, Robbie.
Been on my name.
Nice grab, please.
Sorry, school's got a little scrappy.
See you Thursday.
Bye, Scrap.
Bye, guys. Thank you.
You're welcome.